morning. I'm Dr. William Rosenblatt, Director of the AirwayOnDemand course. This morning we're going to talk about the preparation for the swine trachea laboratory. These are some of the supplies that you might want available for your laboratory. First of all, we have a surface table that's covered with plastic. This happens to be our break and lunch room here at the hospital, so I've covered it with plastic. You might want some kind of absorbent towel or blanket when you're first working with the swine tracheas because they can be quite wet. A regulated waste bucket is a good idea to have to dispose of the swine tracheas. We have small, medium, and large gloves. We have cover gowns for those who don't come in scrubs, some antiseptic wipes, and also I failed to mention some tape which was used to secure the plastic onto the table. The AOD setup for the swine trachea lab uses a wooden board. Any kind of board is fine. It should probably be about 3/4 of an inch, any type of wood. This is a special board that's used by AOD that has a groove around the edge, and it measures about 8 inches by 6 inches minimum. Other supplies that we use include 1 or 2 heavy-duty stapler guns. These take a T50 staple with a size of 10 or 12 millimeters, and a pliers which will allow you to reuse the boards for a new trachea during the same workshop. I would advise that after the workshop the boards be discarded because they will be stained with swine secretions. I have a box of the 12 millimeter half-inch T50 staplers here. You also might want to have a large bucket. In general, the tracheas will come to you frozen, often on dry ice. They'll be rock hard. It's nice to have a bucket filled with hot water to place the tracheas in and defrost them. You'll need to do this ahead of time. If you have access to hot water, you can usually do it within an hour of the workshop. So when we do the preparation, you'll need a piece of swine skin. Often they're cut in irregular sizes or too large for the preparation, and we will cut that down. And of course, one of the tracheas. So here we have the swine larynx and trachea. It does not appear as a human trachea would. Here we have the arytenoids, here we have the thyroid cartilage, and in fact on this specimen part of the thyroid cartilage has been cut away. When you're procuring your tracheas, you may want to procure more than you actually need because often the slaughterhouse will destroy some of the specimen. In fact, this specimen has been pretty well split, and we can open up the thyroid cartilage. You can see that the thyroid cartilage is actually about 5 centimeters in length, much longer than the human thyroid cartilage. We then have the cricothyroid membrane, where my thumb is, which will be our target, and then the cricoid cartilage below. And you can see we have a nice wide open patent larynx and trachea in this model. Of course, this particular specimen will not be useful for the workshop. Here's a much more intact specimen. The arytenoids, area epiglottic folds. Here we have what's left of the thyroid cartilage. In fact, I think that for the most part it's intact. And then as we palpate down, we'll find the cricothyroid membrane on this specimen way down here. So quite a long thyroid cartilage. So the way to prepare the specimen, I'm going to place the larynx and trachea in the middle of the board, and then I'm going to take my staple gun and just staple into some of the excess tissue. That's very messy. Usually 4 or 5 staples will suffice. I'm now going to take my skin, place it over the specimen, and Also staple it tight against the specimen. Either before or after you staple down the skin, it may be good to trim it to make the specimen a little bit neater for your student. And also, at times, the slaughterhouse will not send you enough skin, and you may want to reuse some of the skin. Hi. So now that we have our specimen, we have a pretty good feel of the thyroid cartilage, certainly of the trachea here. As we point down on the cricoid cartilage, we come to an indentation. That, of course, is where your cricothyroid membrane is, and that's where we'll be doing our work. So the milker is designed to go through the cricothyroid membrane, but it's not designed to go through the skin. So the first procedure is to make a skin incision. So you want to cut through the skin over your cricothyroid membrane in a vertical incision at least 1 centimeter long. Take our syringe and needle, okay, and now the kit comes with either a stainless steel needle or a 20 gauge angiocat. I actually prefer the stainless steel needle, okay. You're going to place the needle through the incision, okay, 90 degrees to the plane of the C-spine, okay, and the reason we do that, if you go too far, you'll hit the backside, and as you go, you want to aspirate as you go, and you should get a pretty clear aspiration of air. And frankly, on this model, that can be tough to find, but it should be absolutely clear when you have the aspiration of air. Once you have the aspiration of air, you can dip down and point it in a caudad direction and push a catheter into the larynx. So once you're in, you're going to take the wire. Now the wire has two ends. It has a stiff end, you can imagine would puncture the mucosa, right? And you have a floppy end.
Oh, you said wrong.
So it's not a J wire. Okay, the floppy end goes in, and it should go reasonably smoothly.
I see it. Yeah,
Ooh, there it goes.
Yeah, you may see it come out the trachea. Right.
I said we stuck on something.
And once you have it in, you can take out the catheter. Take your milker, put it over your wire.
Where does the like pointy end point?
And now what I advise is taking it like you have a leather punch. So and it takes pretty hefty pressure in a living being to puncture it into the cricothyroid membrane. And you should feel a real pop as it goes in. Once it's in, go ahead and remove the inner cannula and the wire, and you're left with what looks like a tracheostomy tube.
Oh my god!
Okay?
Yeah, can we say where we could put bag this?
You can bag it. Now, actually, it's 3 millimeters is large enough for a patient to spontaneously breathe through. Okay?